Hi, my name is Tristan, and today we're just going to make a short video to address a few frequently asked questions that we regularly get in our practice when we talk about dental implants, stuff that our patients want to know. And we thought it made sense to just sit down and just go through a few of those things together so that it acts as a little bit of an information piece for anyone out there that might see this video today. So the first question is, what is a dental implant in the first place? It is basically a little piece, a little unit that is between 8 and 15 millimeters long and maybe 5 millimeters thick, and gets placed inside of the mouth, inside of the bone of a patient to replace the root aspect of a tooth that might have been previously there, to restore a gap that is left by a tooth missing, that might have been taken out or that might have never been there. On the other side of the implant then is a little adapter piece that we can then use to make a restoration or to attach a restoration to it to replace the gap that is there. What are implants made of? So the material that a dental implant is made up of is usually a very high-grade titanium metal that is covered on the outside with a titanium oxide, which is a non-reactive structure that doesn't interact with the bone whatsoever. That's great because we don't want the implant to have any effect on the surrounding bone or the body in a general sense. We don't want any metal to kind of come out of the implant. The second benefit of that structure, that titanium oxide, is that the bone, the cells of the bone, have an ability to grow around that structure and form a really tight mechanical bond on the implant itself, which results in a really strong connection between the implant and the bone, which then means that when we put a restoration on top of the implant, when we connect it, that everything is nicely tight and doesn't move and gives a really good hold for the tooth, and then resulting in a really comfortable situation for the patient. What are the benefits of dental implants? So the general benefits of dental implants are twofold. One is that it's an excellent way of replacing a tooth in an area where it might be challenging to get a tooth back with more traditional methods like dentures or bridges. Basically, if there is enough bone and we can place an implant, it's a great way of restoring a tooth without having to do any work on the teeth left and right. That is a really good way of ensuring that a patient with a gap has a very natural feeling and functioning tooth again. Also, what implants do is, due to the fact that they're rooted in the bone and that they are exerting a little bit of force on the bone around the area, is that it keeps the cells of the bone active and it prevents bone loss in that area. If there's nothing done to an area, if there's no tooth, if there's no implant, it can over time lead to the bone shrinking away, and that can make the future situation worse. So an implant is great to just keep everything the way it's supposed to be. What steps are necessary to get a dental implant? So in order to get a dental implant, there is a couple of steps that have to be taken to make sure that we get a really good result for the patient. And usually it starts off by doing an implant assessment or a consultation, in which the patient comes in. I might go through the options with the patients, assess the situation, take necessary measurements to ensure that the surrounding bone, that the surrounding gums, that everything is ready to go for the implant. And if there is any treatment that needs to be done beforehand, that we can start that before we actually go in and do the implant treatment. Any necessary impressions or x-rays that need to be taken to assess the situation will also be taken on that time. And then when the patient leaves, usually we have a provisional treatment plan made that then will be reviewed by myself or whoever of my colleagues is doing treatment, to just make sure that we have all the necessary information and that everything is checked and that everything is good to go, and that we have the necessary components, the technical aspects, let's say, ordered and ready to go, so that when the patient comes in for next steps, that everything is properly organized and there's no surprises in that way. Now, when the actual surgery happens, the patient comes in, we'll make sure that the patient is comfortable in themselves, that they're emotionally comfortable, that the area that we want to treat is sufficiently treated with a local anesthetic so that there is no feeling in that area. Once that happens, the surgical aspects of the implant placement can take part. Now, thankfully, implant placement and implant surgery is usually relatively low impact for the patient. A lot of patients that will have an implant placed, they might have experienced an extraction beforehand. And what I usually tell my patients is that the extraction is far more intense than the implant placement due to the work that has to be done in that area. So when they come in for the implant placement, the overall sort of experience tends to be much better, and everything is a little bit neater in a way, and the healing afterwards usually is a bit easier as well. Now, once the surgical aspects have happened, then we usually get the patients back about a few days later to a week later, just to make sure that the healing around the implant is taking place in a way that we like to see. If there is any issues at that stage, we can usually counteract very easily by doing any sort of simple measures that need to be done. And if there's something going in a direction that we did not anticipate, then we can also steer against that. Now, once that checkup, let's say, is done, then the next step happens, which is usually a 3 to 6 month healing period in which the bone around the implant has to heal and has to grow in a way around the implant to make and to form a very strong bond between the bone and the implant. In most cases, it takes 3 months, but then depending on the situation, it might take 6 months, and very rarely even longer, just to ensure that everything is fusing properly. After that time, we then get you back for the first part of 2 of actually restoring the area and to place a tooth there. Now, in some cases, you might get a tooth to go along with the original implant in the first place, if it's a very visible area, for example, restoration. So once we have that healing period over, then we get to the point where we actually make the tooth or the teeth to fit in the gap that is there. That works usually these days by fitting a little, like an adapter on top of the implant, to then take an optical measurement, which is basically a little camera that goes around the implant and the teeth and takes a 3D image of the area, which then is the basis for the work for our lab technician to create a very nicely fitting, aesthetic and natural looking restoration and set of teeth for the patient. That takes usually about 2 weeks or 3 weeks, and after that time, the patient comes back and we just place the new set of teeth or the new tooth onto the implant. Usually these days it's screwed in place, and then we just have to cover up the little screw hole that's in the back and the tooth is there. Obviously afterwards, if there's any adjustment needed, we might do those adjustments, but in most cases, because everything is so precisely measured, there is not so many adjustments needed, and the patient has a very comfortable restoration of the tooth straight away. Can I get a dental implant near me? In my opinion, it's very important that the location of the implant placement, so the practice, is accessible for the patient, because the treatment for implants is usually stretched out over the course of a couple of months, and that is all to ensure that the necessary healing periods can all be accounted for. We don't want to take any steps that would have an impact on the longevity of the implant and the restoration on top. We don't want to cause any issues with the healing. We don't want to take any shortcuts. And that way, I think it is always very important that the location is accessible to the patient. Thankfully, in Boyne Dental, we have 3 locations spread across Kildare and Meath that have practitioners in them that provide dental implants. I myself only work in the Maynooth practice, and I'm very happy to see my patients there for consultations for dental implants, but we have very capable colleagues in Navan and in Drumshanklin as well. What are the risks and complications of dental implants? So whenever we talk about all the benefits of dental implants, it is also important to just have a quick chat about risks and complications that might occur. So with dental implant placement being a surgical procedure, there is the regular risks and complications that any surgical procedure might come with. So usually we're talking about a little bit of pain, maybe a little bit of swelling and bleeding, a bit of bruising afterwards, and in some cases an infection of the area. Now, with the measures that we take to make sure that our surgical procedures are as straightforward and well prepared and well executed as well, usually our patients have very little impact from this, maybe 2 or 3 days where the area is a little bit sore, but after that it usually is much better. And if there is any complications, we can counteract them relatively effectively. Unfortunately, sometimes the implant and the bone just don't heal in a way that we would like them to be healing, and that means that eventually an implant can become loose, or the soft tissues around the implant, so the gums, might not close in a way that we like that to happen. Usually there is a few things that we can do to counteract these things from happening, but even with the best efforts and the best planning and all the best setup, even then sometimes an implant can fail. Another thing that can happen even with the best pre-planning is that there can be damage to surrounding areas, which can include nerves, the teeth, the bone, and sometimes parts of your nose, the sinuses underneath your eyes. Due to the fact that we do a good pre-planning of the surgical procedures and that we have the capabilities of doing digital planning of an implant case, we make sure that we don't get anywhere close to any areas where we might expect a higher risk of damage to the surrounding tissues. But in a general sense, these things can still happen. How long do dental implants last? So there has been a lot of studies that have been done over the whole course of the availability of implants, dental implants, which have been around for about 60 years. The current estimate in almost all of the studies that have been done in the last while is that more than 95% of the dental implants that have been placed are surviving a 10-year time frame, which doesn't mean that an implant will only last you 10 years. It means that for 19 out of 20 people, an implant will be in a good condition after 10 years. And with good care and good maintenance, an implant can last you far longer than 10 years. But it just means that for the one person out of 20, after 10 years, we might be in a situation where there's unfortunately no implant anymore because there were some complications that could not be foreseen beforehand. Will I get all the treatment in one place? The setup that we have at Boyne Dental is great in a way that we have a multidisciplinary team where we have a team that consists of almost all the specialties that you can find in a dental setting. We have people that specialize on the placement of implants. We have periodontists, we have oral surgeons, we have endodontists, so which means that we can approach any patient situation from a lot of different angles. And if there is a specific need for a specific treatment, we always have an expert at hand to help us with that, which is very handy in a general sense. Now, if someone comes in for an implant assessment with myself and we go through all the treatment options, I can let them know at that time, will all the treatment be done by myself, or do we have to take into account any sort of consultation with a specialist that comes in from a different part of the practice? For most of the cases, I will be the only person that a patient will have to deal with. On top of that, there's obviously the nurses, the admin team, but in most cases, there is no need to have any other dentists involved in this. For some people, that is very important because they want to build up a bit of trust, and it's a significantly big treatment for a lot of people. So they appreciate that everything comes out of one pair of hands. But it is always good to know if there is any need for a specialist, we have them at hand. Are implants safe? All the materials and the procedures that we use in order to place implants and to do the work that surrounds implant placement in general is tried and tested methods that have been peer reviewed and that have been that all of our practitioners, including myself, have learned from certified sources and through certified courses. All the materials that we use have been tested by the relevant authorities on the national level and the international level to make sure that the materials and the instruments that we used are all tested. And then obviously internally in our practice, we ensure that all the necessary precautions are taken, like cleanliness of the surgery and the field. We scrub up for our dental implant placements to make sure that we have the lowest possible chance of contamination with any bacteria in the area. And then obviously our general disinfection and sterilization techniques for our instruments are all up to the standards that are required. How long does it take to get dental implants? So currently the situation to get dental implants is relatively short term. We can usually book you in within a month or so of the original consultation to get your journey on the way, to get your implant placed. And then depending on your situation, it might take 3 to 6 months until you get the final permanent tooth. In the meantime, depending on whether it's a visible area or not so much, you might or might not have a temporary tooth placed in the area, and there's different options to get that done. And then usually after, if it's a quick case and if it's a standard case, after maybe 3 or 4 months, and then in a longer case after 6 or 7, 8 months, you might have your treatment completed. If it's a very complicated case and it needs a lot of different steps and preparation for the treatment, you might look at a longer time frame. But if that's the case, we will let you know at the time of your consultation so that there's no big surprises. And for some people, it's very important to have the predictability in this because they might have some sort of family event or some time frame that they want the surgery to be done or the result to be finished. And it's important to talk about this at the start to make sure that all the expectations are taken into account. Will dental implants cure gum disease? The short answer is no, they don't cure gum disease, but they can be a great way of replacing teeth for someone who has lost a tooth or multiple teeth due to gum disease. Now, gum disease or periodontal diseases can also affect an implant in a very similar way. We call that peri-implantitis. It is definitely something that needs to be considered in someone who has had issues with periodontal diseases with gum disease beforehand. And we make sure that before an implant is placed that we have the general situation prepared in a way that the implant will have a good chance of not having any issues. And if there are any issues, that we can address them effectively and promptly. Generally speaking, the better oral hygiene a patient has, the better they clean the implant, the better they floss in between the teeth, the more likely it is that there is a long-lasting good result with the implant as well. Will dental implants prevent bone loss? Generally speaking, having an implant placed can be beneficial in terms of preserving bone volume. Basically speaking, if you don't do anything with a gap that you might have in the teeth, the underlying bone level will slowly shrink away because the cells in the bone don't have any activity placed on them, which makes them less active themselves, and it leads to an overall loss of bone over time. If an implant is placed significantly fast and has a good bit of bone around it, due to the patient using the tooth that is attached to the implant, it puts a little bit of pressure on that area in the bone, and it means that the cells have a bit of activity around them, which means that they can preserve their shape longer. Now, over time, similar to a natural tooth, the bone levels around an implant might still drop a little bit, which the patient can usually counteract with improved oral hygiene and good regular checkups and making sure that they have the overall situation in that area as healthy as possible. But still, over time, a little bit of bone loss can be expected. Is the treatment expensive? Are implants worth it? In my eyes, implants provide a great way of replacing a tooth or multiple teeth in a gap, or even full arches. And if we compare them to more traditional options like dentures or bridges, I think the value that they provide is great because in all ways they feel very much like a natural tooth. You don't have to touch any of the surrounding teeth and do any work to them like in a bridge. And because they are so strongly rooted in the bone, they act as a really good foundation for any restoration that we place on them, and it makes it for a really comfortable result, especially if you look at the long-term effects of having implants placed and the way that it can affect a patient's life and the ability to chew and to get the right nutrition in and all of these kind of things. I think it really improves the quality of life for a patient. What does the full dental implant cost? The cost for dental implants depends on the situation and depends on the preference of the patient as well. We ensure that we find a suitable option, a suitable treatment option for the patient, be it an implant-based solution or something that is not dependent on implants. Because the treatment options are individualized, that also means that the cost is usually individualized. And a general blanket statement on how much implants cost. It's very difficult to do. For a very standard, uncomplicated and single tooth restoration with a single tooth in an area that doesn't need bone grafting, at the moment you can expect a cost of about €2,600, including all of the work that is necessary, the surgery and the lab work and all of that. Any costs for any additional treatment or the specific individual price for bits of implant treatment can be looked up on the website, but it is very difficult to give a general statement because it really depends on the person's needs. Can I split payments for dental implants? Yes, that is generally possible. The time frame of dental implants and the duration that it takes to get you a result usually is a couple of months between the consultation and the final result, with a number of steps in between, where that in itself provides a natural splitting of payments and drawing out of the payment over a longer time frame. If any patients have any more concerns about the financial side of the treatment, but they wish to go ahead anyway, our admin team can always find a solution that works for the patient. So if we encounter a situation like that, I usually make sure that our patients are in good hands on that side, and they will figure something out for the patient. Are implants tax deductible? At the moment, the placement of implants and the restoration of implants can indeed be placed against your taxes. In Ireland, there is specific rules which dental treatments are tax deductible and which ones aren't. At the moment, non-routine dental treatment is possible to put against your taxes, but tax rules might change over time. So it's always good to check the situation either online or with a tax consultant, just to make sure that before you engage in this, and if you expect it to happen a certain way, that you're sure that it actually happens that way.